Welcome to our doc talk about varicose veins. With me, I have one of our vascular surgeons, and I'll ask him to introduce himself.
Hi, my name is Jack McCallum. I'm one of the vascular surgeons at Valley Medical Center.
Let's start with our first question. What are varicose veins?
Varicose veins are abnormal veins that are near the surface of the skin. They often appear as bulges just beneath the surface of the skin. They can appear bluish. Another condition that's related to varicose veins are telangiectasias or spider veins, which are tiny clusters of red or blue veins just below the surface of the vein. Together, varicose veins and spider veins are considered part of chronic venous disease, which encompasses several other conditions as well.
What are the symptoms of varicose veins?
For many patients, varicose veins have no symptoms. For other patients, varicose veins can be painful, which some patients describe as aching or like a muscle cramp. For other patients, varicose veins can lead to discoloration of the skin, both around the varicose veins and also sometimes at the ankle. In severe cases, varicose veins can be associated with the formation of wounds or ulcers or with clotting of blood within the varicose veins.
What causes varicose veins?
For many patients, varicose veins are just caused by sitting or standing for long periods of time. For other patients, varicose veins are caused by an associated condition called venous reflux, which is when blood flows the wrong direction through an associated vein, typically a saphenous vein. To understand that, a little bit of anatomy. Normally, the heart pumps blood to our arms and legs through arteries, and our veins carry blood back to our heart through the action of moving our arms and legs around. When we aren't moving our arms and legs, blood flow through the veins is helped to maintain in that normal direction by little valves, little pieces of tissue in the veins that only allow blood to flow towards the heart. In venous reflux, those valves are damaged. That allows blood to pool and pressurize in the limb. That can be associated with the formation of varicose veins.
Who is at risk for having varicose veins?
Varicose veins are very common, so really everybody's at risk. The prevalence, how common they are, also increases with age. People who are at even higher risk are people who have been pregnant, who are overweight, who smoke cigarettes, who have had blood clots in the legs that have damaged the valves in the veins associated with the varicose veins, or who have venous reflux.
How are varicose veins diagnosed?
Varicose veins are typically diagnosed by visually inspecting the leg, either done by patients themselves or by their primary care doctors. The underlying cause of varicose vein, which is often venous reflux, is usually diagnosed by an ultrasound.
How are varicose veins treated?
For many patients, conservative treatment is all they need, and that consists of exercise, weight loss, elevating the limb, and wearing a compression garment on the affected limb, such as a compression stocking. For other patients, if they're still having symptoms after trying conservative measures, we recommend intervening on the varicose veins. The vein cluster themselves can be treated either by phlebectomy, which is surgically removing the cluster of varicose veins, or by injecting a medicine into the cluster of veins to cause them to scar closed, which is called sclerotherapy. Often clusters of varicose veins with symptoms are associated with reflux in what's called a truncal vein, a superficial vein which runs along the length of the extremity, such as the saphenous vein. And we recommend closing the saphenous vein by one of two techniques as well in those cases. The first technique is called radiofrequency ablation, which uses heat to cause a saphenous vein to be closed. The other technique is called VenaSeal, which uses glue to close that saphenous vein. Both of those closure techniques serve to depressurize the varicose veins, which are downstream of some venous reflux.
What are possible complications of varicose veins?
For most patients, varicose veins remain asymptomatic or mildly symptomatic throughout their lives. Varicose veins do tend to grow over the course of their lives as we spend more time vertical. For other patients, varicose veins can become more painful over the course of their lives. Other complications include blood clot formation within the clusters of varicose veins and the formation of venous wounds, such as ulcers or open sores at the ankle.
Under what circumstances does treatment for varicose veins become medically necessary?
When patients have pain associated with their varicose veins, that's most commonly when we recommend surgery. Other more serious complications for which we do also recommend surgery would include repeated blood clots within the varicose veins, or the formation of wounds or skin changes at the ankle with ulcers or open sores.
What can people do to prevent varicose veins?
To prevent varicose veins, people should maintain a healthy weight, remain active throughout the day, and avoid smoking cigarettes.
Thank you for answering our questions, Dr. McCallum. And for those watching, to learn more, we encourage you to go to our website,